When we're looking at acid reflux, we really want to understand this LES valve, or this lower esophageal sphincter at the bottom of the esophagus. It opens up when we eat food, the food comes in, and then it's supposed to close so that while that food is being acidified, those acids don't come back up and burn us and make us scream at the neighbors. So what's wrong with this acid reflux situation is that the problem is that this LES valve is triggered by stomach acid. And it's really common for someone not to be making enough stomach acid. So if someone's just making a little bit of stomach acid, but it's not enough to trigger this LES valve to close, then that small amount of acid that's being made is going to come back up and burn them, and then they're going to cuss a whole bunch. So that's what we're looking at when we're looking at acid reflux. It's usually a hypochlorhydria issue or a lack of stomach acid. But when someone's experiencing bile reflux, this bile that's coming down here is then coming back up into the stomach. It shouldn't be going into the stomach. It doesn't belong there. There's a reason that our stomach makes stomach acid, and we want that to happen. We want to digest our food. What we want to look at is why would this stuff be coming back up here? And that's when we want to look at this pyloric sphincter. So this is the LES valve up here, and there's another one down here at the bottom. What happens is once this food is acidified in the stomach and leaves here, it's this acidic product entering to the duodenum that triggers this pyloric valve to close so that stuff doesn't go back up into the stomach. And it's also these acids coming down that triggers the gallbladder to squirt this alkaline bile down here to help neutralize those acids. It also triggers this to squirt some bicarb out here from the pancreas to help us neutralize those acids as well as other digestive enzymes we'll use. So it's this acidic action here in the duodenum that triggers these things to happen. And so what happens is a lot of people are not making enough stomach acid for a wide variety of reasons. And they're not acidifying that food correctly, so the acid doesn't come down and trigger these other things to happen. So when this food is not acidic enough to trigger this sphincter to close correctly, then things are going to move the wrong direction. When bile comes down to help us emulsify the dietary fats we ate, then it can move in the wrong direction. And when this bile is going into the stomach, it's like this soapy detergent-like substance, and it's alkaline, so that can further alkalize the stomach. It can irritate all of the lining in the stomach because it's not meant to be alkaline there. It's not meant to have that soapy substance in here. The bile should be coming down here. It shouldn't be going into the stomach. So when it's going back in there, it can create a whole lot of trouble. So if bile is flowing back up into the stomach, that's going to even further alkalize the stomach and restrict your ability to acidify that food. It's also going to restrict your ability to acidify the stomach enough to trigger that LES valve to close. That's why it's so common to see people with acid reflux and bile reflux, or even bile reflux gastritis.